Good morning. My name is Sharika. I'll be your nurse today, and I'll be inserting your Foley catheter. This will help to maintain, to drain your bladder and monitor your urine output. If you feel any signs of discomfort or have any questions while we're doing the procedure, just let me know. First, I'd like to confirm your identity. Can you state your name and date of birth? Do you have any allergies to iodine or any type of latex? Okay, I'm going to start off by washing my hands to ensure that everything stays clean and sterile during the procedure, and I'm going to put on some clean gloves. Now, I'm going to position you in a dorsal recumbent position so that you can lay back with your knees bent and your feet flat on the bed so that we'll be able to have better access during the procedure. And then I'm going to clean your perineal area using a cotton ball. Wipe, discard, wipe, discard, wipe, discard to reduce the risk of infection. Once I've completed the perineal care, I'm going to remove my gloves, discard, and wash hands after performing perineal care. Now I'm going to prepare my sterile field and gather my supplies. So in preparing the sterile field, I have gathered my pack. And I'm going to unwrap the kit and being careful not to touch anything so that everything can remain sterile. I will remove my gloves from the kit, and then I'm going to place them on the side. I'm going to open the gloves using the edges of the wrapper on the side. And then I will insert my hand into the glove, right here, and I only touch the area to slide them on in order to maintain the sterility. Pulling them on real tight from both sides, and then I'll take the gloved hand, and then I will pull the gloves here to put it on the other hand, and now I have on sterile gloves. I'll take and remove the drape paper away so it doesn't contaminate the sterile field, and then I'm going to prepare all of my supplies. So I will take this drape, fold it and tuck it a little bit here, and put it under the patient without touching the borders to maintain a sterile feel. And then I'll take this drape and drape it over the patient's body as well. Okay. And then I'm going to prepare my supplies. So everything's in the sterile field to maintain sterility. Now I'll take and pour antiseptic solution over the cotton balls and the urine specimen if needed, and then prepare the specimen container. I'll take my catheter, and then I'm going to lubricate the tip of the catheter with the lubricant in order to make sure for a more comfortable experience, and I'll lubricate about 1 to 2 inches. Okay. And then I'm going to clean the area before inserting the catheter. So with my non-dominant hand, let me know if you feel any discomfort. I'm going to spread the labia using my non-dominant hand, and I'm going to clean with the antiseptic wipe, going down, 1 stroke, discard, down, 1 stroke, discard, down, 1 stroke, discard. cleaning the area, starting with the labia fold, and then cleaning from top to bottom and discarding the cotton ball after each single stroke. Now that I've completed cleaning the meatus, I will be ready to insert the catheter. Patient, please take a deep breath for me. Take a deep breath. As I insert the catheter gently. If you feel any discomfort, just let me know. I'm going to insert the catheter about 2 to 3 inches into the urethra. And then once the urine begins to drain, I'll advance the catheter another 1 to 2 inches. I'm seeing urine. Okay. Then the catheter is in place and I see urine. I'll go a little bit further for proper placement and hold the catheter with my contaminated hand. And then I will take my syringe, remove the tip, and then I'll inflate the balloon with a sterile water to keep the catheter securely in place. You might feel a little tug, and a little resistance, but that's pretty normal. I'm going to inflate the balloon with my syringe. The catheter is secure. Okay. And then the catheter is secure, and now I will attach it to your leg with the Velcro strap for comfort, but I'll leave you enough slack so that you can move around freely. I'll check for drainage to make sure that the lines are not kinked, and I'll hang the collection bag from the bed frame and make sure that it doesn't touch the floor so that it doesn't be contaminated. Please avoid pulling the tube. And if you experience any type of discomfort, please use your call bell and let the nurse know. I'm going to now document the procedure, recording the time of catheterization, the catheter size and type used, and also the amount of urine that's been drained, and the description of the urine and the patient's tolerance to the procedure. Now, when removing the catheter, it's a quick procedure. I'm going to introduce myself, do my hand hygiene, explain the procedure to the patient as well, and let them know that you might experience a little bit of discomfort, but it won't be painful. If you have any questions or concerns during the procedure, please let me know. I'll deflate the balloon, holding the catheter in place and gently removing it, and the process will be very quick. You might feel a little pressure, but it won't hurt. I'm going to wash my hands now to make sure that everything remains clean and the procedure's in place, hand hygiene and putting on gloves. And I'll position you on your back so that you can relax. So take slow, deep breaths while I remove the catheter. And if you feel any discomfort, let me know. I'll start off by draining the urine from the bag. And then I'm going to disconnect the bag now. Okay, so now that the catheter is in place, I will begin by deflating the balloon, and it'll only take a moment. Attach the syringe to the balloon port and withdraw the sterile water from the balloon. The balloon is now deflated, and then I will gently remove the catheter. So please take slow, deep breaths as I begin, and then I'll pull out slowly in one smooth motion. The catheter is now out. So if you might feel a little bit of discomfort when you urinate for the first time, but it'll go away real quick. I'm going to discard of all of my equipment, and then take my gloves off and perform hand hygiene. And then I'll document the procedure, including the removal, the time, how the patient tolerated the procedure, and any observations about the urine output or condition. And this concludes my video.